Good morning. I'm Dr. Bob Hopkins, Medical Director of the National Foundation for Infectious Diseases, or NFID. Welcome to the first in a series of NFID respiratory season news briefings featuring medical experts and special guests to respond to real-time developments throughout the respiratory season. For more than 50 years, NFID has been educating and engaging the public, communities, and healthcare professionals about the prevention and treatment of infectious diseases across the lifespan. Today, we focus on children and pregnant women, two groups that are especially vulnerable to flu, COVID-19, RSV, and pneumococcal disease. In upcoming briefings, we'll highlight other populations. Respiratory diseases can be serious, causing potentially life-threatening complications even in healthy children and adults. During the 2024-25 respiratory season, for example, 280 children died due to flu-related complications, most of whom were not vaccinated. This is the highest number of pediatric flu deaths since the 2009 H1N1 flu pandemic. With evolving and sometimes conflicting vaccine guidance, we know people are confused. I hear that from my own patients who have more questions than ever before. It's good to have questions, but it's on all of us to make sure that everyone has access to evidence-based information to address those questions and help people make informed decisions about their health. We'll turn to our panel of experts in a few moments, and then following that, we'll take questions from the media. But first, we want to start by sharing a powerful reminder of why vaccination matters. I'd like to introduce you to Michelle Stevenson and her son, Caden, who will talk with Michelle Slavkovsky of the Families Fighting Flu about their experience with serious flu complications.
Hi, I'm Michelle Slavkovsky. I'm the Executive Director of Families Fighting Flu. Joining me virtually today is Michelle Stevenson and her son, Caden. Caden is a courageous flu survivor, and Michelle and Caden are here today to share their story and how the flu impacted their family.
Christmas break in 2022, my baby got a little sick. I didn't think anything of it. Long story short, over the course of the weekend, he just got really sick. I knew something wasn't right, so I ended up taking him to the emergency at our local hospital, where they ended up telling me that my son was super sick. He ended up getting flown about 2 hours away from home to another children's hospital, where basically I realized how sick he was. They ended up telling me that Caden was sick with flu and he had strep, and then I found out he was septic and he was in multi-organ failure.
It was really scary. We thought we was going to lose him, but they saved his life and saved ours too, because I don't know what we would have done if something did happen to him.
And it's just been like a journey since then. He ended up with double leg amputations. They still have to monitor his heart. He had some heart issues afterwards. He's still on blood pressure medicine from that. So we just have to continually monitor him. I know now how serious flu can be. Just making sure that I stay on top of anytime he is sick.
Keep an eye on your kids. If they say they're not feeling good, don't shove it off. A lot of people say, oh, it's just a flu, he'll get over it, whatever. But yeah, when your kids are telling you something, listen.
I was vaccinated. I was so busy at the time. I'm a single mother, and he didn't have any doctor appointments at that time. So I didn't even know he could go somewhere else to get his vaccination. But I do wish that I had asked around, because I didn't. I didn't ask my doctor or even call his doctor to see if he could get in at that time. I thought I just had to wait till he had his next appointment to get his vaccination. And then make sure that you're talking to healthcare professionals. Make sure that you go get whatever information that you need. Never assume that you know what's going on with your child. Listen, pay attention, and talk to your doctors.
Yeah, we didn't realize that the flu could cause so much damage. So it's nothing to take lightly.
Thank you, Michelle and Caden. Now I'd like to ask each of our panelists to briefly introduce themselves. And let's start with Dr. O'Reilly.
Hi, My name is Sean O'Leary. I'm here with the American Academy of Pediatrics.
Thank you. Dr. Riley?
Good morning. I'm Laura Riley, and I am a maternal fetal medicine specialist, and I am here representing the American College of Obstetricians and Gynecologists.
And Dr. Gellin?
Thanks, Bob. I'm Dr. Bruce Gellin. I'm an adjunct professor of medicine at Georgetown. I'm here representing the Vaccine Integrity Project, which was launched in April to safeguard vaccine use in the U.S. It remains grounded in the best available evidence, free from external influence, and focused on optimizing protection of individuals, families, and communities against vaccine preventable diseases.
I want to thank all three of you for being here with us. Let's start with a few questions about pediatric and maternal vaccine uptake. Dr. O'Leary, last season, less than 50% of children nationwide received flu and COVID vaccines. What do you think is driving this, and how should the public and healthcare professionals respond?
Sure. I think, we have been working for years to get flu vaccination rates up, and they'd gotten actually up to roughly 60% or so of all kids were getting vaccinated every year coming into the pandemic. And since the pandemic, we've seen that fall, unfortunately. And, there's of course a lot of headlines out there about vaccine refusal and vaccine hesitancy, but most parents actually strongly believe in vaccination. And a lot of the reason that I think we're seeing the fall in the rates related to influenza are related to access issues. Pediatric offices, family medicine offices are often understaffed, and sometimes people have trouble finding a place to get flu vaccine. As you saw in that really powerful video, it wasn't something that was easy to do. And so I think for a lot of people, getting these vaccines is not necessarily easy to do. COVID, of course, is a different story, and there may be a little bit more refusal for COVID than flu for a variety of reasons. But I think also if you look at a lot of the surveys that have been out there, a lot of parents would get COVID vaccine if it was offered to them strongly by their pediatrician or family doctor. If they said, I believe strongly that you should get your child vaccinated against COVID, I think a lot of parents would actually get their child vaccinated, because the difference between the percentage of parents who say they would and what we actually saw is a pretty big difference. So I think a lot of it actually is also access related issues. And certainly we've seen a lot of threats to the access to COVID vaccines and other vaccines in recent weeks and months.
Thank you. Dr. Riley, how does vaccination during pregnancy protect both the mother and the infant? And how do you communicate that value to expecting parents who may be hesitant?
Yeah, I think one of the unique opportunities that we actually have in pregnancy is that you have about 10 visits with your healthcare provider over the course of pregnancy. So there is an opportunity to sort of give the information multiple times, which for some people that's what it takes. I think the important thing, which I always try and explain to my patients. In fact, I saw a whole slew of them yesterday, and the conversation really revolved around the fact that we have very good data suggesting that getting the flu in the middle of pregnancy, or at any point in pregnancy actually, can be quite serious, and it's unpredictable. So even the healthy pregnant women who get the flu can sometimes land in our ICU or have some other issue. And so I think once people understand that the flu shot's going to protect them from the flu or from those severe outcomes that you can have with the flu, and then the added benefit is that once they build those antibodies, they cross the placenta and they can and find their way into the baby, thankfully, for the first 6 months when the baby can't be vaccinated. So, it's a huge bonus. The same thing has been seen for COVID. When pregnant women get COVID, the COVID antibodies then protect the baby, and then of course RSV. So all three are protective.
Thank you. Dr. Gellin, you help lead the Vaccine Integrity Project, which works to strengthen the vaccine ecosystem across the U.S. What are some of the key strategies being explored to ensure equitable access to immunization, especially for families?
Yeah, thanks. I mean, as Sean highlighted, access is probably going to be a theme throughout this, and the importance of navigating what has unfortunately become a more confusing landscape than it should have been. As I mentioned at the beginning, when we launched the Integrity Project, the first thing we did was talk to everybody who could find about, and the question was, if you're not the government, what could be done? to help to shore up the system, as you mentioned. And importantly, when we did that, we talked to clinicians, we talked to the medical societies, including those who are here. We also talked to insurance because it was clear that they were looking at this as well, recognizing that the questions about insurance and some of the changes were going to be front and center, and that so much of access is not only the logistics that Sean mentioned, but also would they be covered. So I think that from that standpoint, having them as part of the conversation early on, so they could also hear from the front lines of medicine about what they needed to be clear about. It still is confusing, even though the insurers have been very clear recently that they're covering the vaccines that were recommended prior to September 1st. So that clarifies some of it. I think that with time, some of that confusion will dampen down as people get into some of the routine, but it's still relatively new now that we are here in the respiratory season.
Dr. Riley, can you walk us through ACOG's updated guidance for flu, COVID-19, and RSV vaccinations during pregnancy?
Sure, happy to. As I said before, we know that these respiratory infections are particularly dangerous during pregnancy, even for those healthy pregnant women. And so the recommendation has been for years and years and years, actually, to receive a flu shot during flu season to protect both mom and baby. We also know after the COVID pandemic that pregnant women were severely affected by COVID infections. And again, the recommendation was to receive a COVID booster during pregnancy, recognizing that those antibodies would then cross the placenta and protect the babies. And we have very good data also suggesting that babies whose mothers are not vaccinated do particularly poorly if they get COVID. And then with RSV, thankfully, there's the ability, again, to protect moms from RSV, which we're less concerned about that, but we're way more concerned about, in fact, their babies. And so the recommendation is that all moms receive the RSV vaccine between 32 and 36 weeks gestation to, again, protect their babies. We do have a few guardrails around that one of which is if you've gotten it in a previous pregnancy, the recommendation is that the baby receives a monoclonal antibody and that we don't revaccinate mom. Other than that, I think the major issue, the ACOG guidelines are based on lots of data, lots of safety data for both mom and baby, which I think is almost always the number one question that patients have for me. But is it safe? Yes, it is safe. And we've been, doing studies for years and feel very confident in our recommendations.
Thank you, Dr. Riley. Dr. O'Leary, what does AAP recommend for flu, COVID-19, and pneumococcal vaccinations for children?
Sure. Yeah. So our flu recommendations really haven't changed in recent years. We recommend annual vaccination for everyone 6 months and up. For the first few years of life, up until age 8, you need to have 2 doses in that first season. After that, it's just one every year. COVID is a little different this year. Where ACIP was going, the Advisory Committee on Immunization Practices, prior to the firing of all 17 members, was considering actually moving to a risk-based recommendation for certain populations, including children. And that was based on the reality that we are in a very different place with COVID than we were even 2 years ago. We've seen as more and more data have become available, what's become very clear is that the youngest children are at the highest risk for hospitalization, as are children with certain chronic medical conditions. So the recommendations from the American Academy of Pediatrics this year, which have also been endorsed by the American Academy of Family Physicians and other medical societies, are to vaccinate all children 6 through 20 months of age with a primary series. From age 2 and up, then it becomes a risk-based recommendation. And so that means anyone that has one of the high-risk conditions that are outlined in our policy statement. as well as anyone living in congregate settings, anyone living in a household with someone who's vulnerable to who's high risk themselves. And then we also wanted to make sure that we included vaccination for anyone who simply wants it for whatever reason. There are other reasons that parents may want to have their child vaccinated, including things like prevention of long COVID, simply, less likely to get COVID and maybe less likely to miss school. So there are lots of other reasons, but we really did want to emphasize the importance of getting those younger children vaccinated because that's really their risk of hospitalization is actually similar to the risk of hospitalization for older adults 50 to 64. And I'll say we also highly endorse ACOG's recommendation for COVID vaccination during pregnancy because those infants under 6 months of age have hospitalization rates similar to adults 65 to 74 years of age. And I think everyone recognizes that they're high risk. Those younger kids are really high risk as well. For pneumococcal vaccination, that's been a longstanding recommendation. We've seen invasive pneumococcal disease, which can be a very severe disease, can cause pneumonia, can cause meningitis, can cause a number of other serious infections. We've seen since the institution of that vaccine over 20 years ago now, we've seen rates of those diseases go way, way down. And so the recommendation for that one is it goes along with a lot of the other childhood vaccines we recommend. So it's 2, 4, 6 months, and then at a year. And then for most children, that's it. They're done.
Thank you. Just as a follow-up, many medical associations continue to recommend those COVID-19 vaccines for children, even as the CDC guidance has shifted. Could you reinforce again what the evidence is behind that recommendation, Dr. Larry?
Sure. Sorry, for the COVID.
For COVID, yes.
Yeah. So, I was on the COVID work group since its inception and for ACIP, and I've been to every ACIP meeting throughout the pandemic. There were, I think, more than 50 of them through the pandemic. And the first question at every meeting that voting members, work group members would bring up would be asking about safety. So safety was always the top priority with COVID vaccines. The vaccine safety data link, the vaccine adverse event reporting system. There were other safety surveillance systems as well, VSafe, CISA, a number of safety surveillance systems, such that I would say that COVID vaccines are not only the best studied vaccine for safety in the history, they're probably the best studied medicine in the history of the world for safety. So we have high confidence in their safety, and that's been true through the pandemic, and it continues to be true.
Thank you. Dr. Riley, ACIP called for more data on the COVID-19 vaccine during pregnancy. Is there sufficient data on the safety of COVID-19 vaccines during pregnancy? And how can physicians share that with their patients to build trust?
Well, I would echo, Dr. O'Leary's comment. I mean, I was on the work group as well from its inception. And then there was yet another group added when the vaccine became available, which was called the VAST at the time. And we literally looked at by week, we looked at, side effects from the vaccine, if there were any, and made decisions about whether or not to continue to vaccinate the public. And pregnant women were included in the data, in the safety data that we were looking at on a weekly basis. And there's so much data, so much safety data. So many people have been vaccinated during pregnancy, postpartum, and there really have not been any signals of concern. And I think, I think for pregnant women, it was important for them to understand the importance of protecting themselves from what could have been a very serious illness. And then also, as we were just talking about, I mean, I think that the data suggesting that children less than 6 months of age have a high rate of, severe illness. And literally moms are the only people who can really protect them from those passive antibodies because they can't be vaccinated yet. So I feel very confident about the safety data. There were multiple, it was being monitored in the vaccine data safety link. It was also being, even looking at VSafe finally, we had an online safety surveillance system that included pregnant women. We even added the question of pregnancy. So I feel like, as Dr. O'Leary said, this was a vaccine that was really, really heavily tested.
And Bob, I would add just one other thing that throughout the pandemic as well, at both at the American Academy of Pediatrics as well as at ACIP, even up to the present, um, looked at the question of safety in terms of risks and benefits, and there was no question that the benefits so far outweighed any potential risks throughout.
Great. Thank you both. So, Dr. O'Leary, RSV is now the leading cause of infant hospitalization in the U.S. How is AAP advising families to help protect children from RSV this season?
Sure. So, RSV is something that all pediatricians know very, very well. We see it, it comes every winter. Lots of children are hospitalized with it. And there are unfortunately a number of severe outcomes from RSV. Younger children are particularly prone for severe disease. And now we're in a moment where we actually have multiple products to prevent RSV. Dr. Riley talked about RSV vaccination in pregnancy. So what we recommend for infants is if the vaccine was given in pregnancy and it was more than 2 weeks before delivery, you don't need to do anything. The baby is protected. If the vaccine wasn't given during pregnancy, or it's within that 2 week window before an immune response can be mounted to pass the antibodies to the baby, then we recommend one of two products. There's one called nirsevimab, and there's another one called clesrovimab. They're both very effective and very safe. Those are recommended for all infants under 8 months of age. There are certain infants, certain high-risk infants, roughly about 2% of any given birth cohort, that we recommended in the second year of life. And those are things like for severely premature infants who are still on oxygen, things like that, highly immunocompromised children. So a pretty small percentage for that second year of life. But we're already seeing population level impacts even in this last season with decreased hospitalizations really across the US, and that's been shown throughout the world.
Great. Dr. Gellin, can you help us understand current efforts to ensure that the U.S. immunization recommendations remain grounded in the best available science?
Sure. I mean, as both Dr. Riley and O'Leary mentioned, there are a number of systems in place that are monitoring both the safety and the effectiveness, and those are the things that we've relied on for a long time. The Integrity Project I mentioned was really looking at with a focus on evidence. And what we did, particularly for this season, was to do we aligned a group nationwide experts in virology, epidemiology, clinical practice, and research methodology to do a massive review. And we reviewed all the peer-reviewed literature. So that's on top of the systems that we'd mentioned before. We reviewed all the peer-reviewed literature where these three viruses or the diseases were mentioned. It started with 17,000. It was winnowed down to a review of almost 600 that were teased out to look at the vaccine efficacy, vaccine safety, co-administration, epidemiology, and virology among each of the different populations. Here we're talking about pediatrics and obstetrics. Other populations included adults, older adults, and immunocompromised. So you can imagine the complexity of all this. But that was the basis on which the evidence review was developed, so that the medical societies, in addition to the other ways that they look at this evidence, could use that as the basis for making the recommendations that they have.
Right. Dr. O'Leary, how should pediatricians counsel parents who are confused or concerned about evolving guidance coming from the ACIP?
Yeah, things are pretty confusing right now, unfortunately. There's so much information for parents to navigate these days, and I think, unfortunately, not all of what you hear or read on the internet is true. And the falsehoods shared at ACIP have really added to that. There are simply just more and more false, harmful claims about children's health topics spreading throughout society right now. It's a really tough time. So I think pediatricians should navigate these questions really from a place of trust and collaboration with families. Remember, parents really just want to do what's best for their children, and so does their pediatrician. And so I think we can remind parents that when we answer their questions, it's with their child's well-being in mind. The internet and lately, unfortunately, much of what is coming out of ACIP is another story. The information swirling around online is often wrong, and it's sometimes, frankly, dangerous. People on the internet may not have, and often do not have, your child's best interests at heart, but your pediatrician does.
Dr. Riley, how should obstetricians counsel pregnant women who are confused or concerned by conflicting guidance?
I think the first thing is that we have to be sure that we know what the guidance is, and we're doing our best to put out practice advisories and just make sure that obstetrician, gynecologists, and midwives are giving an appropriate message based on the science. And so we've re-looked at the science. We're using the information from the Vaccine Integrity Project, in addition to all that's been accumulated in pregnancy and lactation. And so I think sharing that information, with patients, not only, I think even I sort of fall into this, the pregnancy visits are really quick. They're 7 minutes, right? So the patient comes in, they have certain things that they want to ask you about, and then you need to be able to slip in there, for your best, health. I'm recommending that you have the COVID vaccine, the COVID, booster, the flu vaccine, and if you're in the right window, the RSV vaccine. I think slipping in the recommendation is incredibly important. I think if we don't slip in the recommendation, it doesn't give people necessarily the opportunity to ask questions. And I do think that many patients just need their questions answered. And I feel as if, as physicians and midwives, we are the ones that you should be asking. I think, I agree with Dr. O'Leary that Instagram has a new story every minute. And I always try and remind people that if it's not sensational, it's not going to be on Instagram, right? So in my office, though, I can tell you the boring things about the safety, data that has been accumulated for the flu vaccine. And hopefully that is what, sways people. I think the other thing to remind patients is that I have their best interests at heart. Like everything we do, checking your blood pressure, checking your urine, checking your baby's heart rate, we're doing all of those things because we want you to have a healthy baby. So if that is our goal, which I know it is, it's our shared goal, vaccinations are yet another intervention that we have available to help you have a safe, healthy pregnancy. And we have about 10 visits to be able to get that information across, considering we have 7-minute visits these days.
Well, Dr. Riley, I think it's important to reemphasize the point you made. In the clinical setting, between us and our patients, boring is good. Right. On Instagram and social media, they don't like boring. So that may explain a lot of the reason for the difference in what people are seeing in those settings.
Exactly.
But Dr. Gellin, changes in ACIP recommendations can affect insurance coverage for vaccines. What do families need to know about navigating coverage for the vaccinations their doctors recommend?
Well, as I mentioned earlier, this is less confusing than it was just a few weeks ago, as the insurance has stepped forward to make it clear what they're doing. And as I've had conversations with other clinicians and with people on the front lines, like the pharmacists, early on this was confusing, but with the daily practice, it's now becoming less confusing. So I think that's not the barrier that it was going into all this when that was clearly in the crosshairs. But I think as both Dr. Riley and Dr. O'Leary mentioned, it gets down to the relationship between the doctor and the patient, to make those strong recommendations based on the evidence. A lot of patients are going to want to get into some of that evidence, and navigating those conversations in a short period of time isn't so easy. But I think that's what these experts are so good at. The Integrity Project, as I mentioned, had a massive review. I'm not sure it's for everybody, but one of the things we did, and it's in the process of being finalized, is to try to make the data a little bit more visible, in the sense of, no one's going to read these 17,000 abstracts that I mentioned, but there'll be a way that if you are interested in vaccine effectiveness of pregnant women, you can then look to see what are those half a dozen studies that were specifically leaned on for that. So that's coming, and that will be available soon. But again, for those who want to dig into it, they'll be able to see exactly what the evidence was, and they can read about it themselves.
Thank you. Dr. Riley, what role does shared decision-making play in vaccine conversations during pregnancy? And how can clinicians balance evidence-based guidance with patient autonomy?
I think that it's really the crux of us being successful, actually, in taking care of our patients in multiple areas, not just vaccines. I think, it is important to know the data in the sense that I think what patients want to know is, why are you making the recommendation that you're making? What do you know about the safety of this vaccine? And is it even effective? I mean, those are probably the two top questions. And who is this protecting? This is protecting mom and this is protecting baby. I think that having those conversations with patients and then listening to what their concerns are is incredibly important. Also, what I always tell my trainees is that it's also important to be honest with patients and tell them what you don't know. I mean, there are things we don't know, right? That's why there was so much monitoring of the COVID vaccine after it was, put into the world. And I think that it's very fair to say that, this is what we know about the safety of, flu vaccine, which we've been giving for years and years and years. So we know a tremendous amount. We know it's not associated with miscarriage. I can easily tell people that. I can easily tell them that the flu vaccine is not associated with, congenital malformations and things that people are worried about. And then that dialogue, actually, I think is what helps people get to where they need to be. I think the other piece with the shared decision making that's important is that that's kind of how we practice medicine anyway. So it's not like shared decision making is anything new around the vaccine conversation. I do think, though, that, again, in order to really engage in shared decision making, you need to know something. You need to have evidence and you need to understand the science and how to apply that to making those recommendations. And I think that that's what we're trying to be sure that people can do on a daily basis.
Knowing the science, knowing the patient, and having a respectful conversation. It's what we do every day.
100%.
Dr. Gellin, how can public health institutions and initiatives like the Vaccine Integrity Project help people get updated information so they can make the best health decisions for themselves and their families?
Well, so you've got the right panel, but particularly because you have Dr. Riley and Dr. O'Leary here. As I mentioned, we did this massive research of the peer-reviewed literature to develop an evidence base. But it's these societies and making sure that their practitioners have the evidence that they need and have the ability to answer the questions that are going to come to them that then trickle down to the patients in those encounters. So I think that's at least in that cascade of information, that's how I see it. I also wanted to pick up on a comment that Dr. Riley mentioned about science and what you know and what you don't know. I think one of the things that was it was very visible to everybody was how much during COVID the science was evolving, and that's the way science works. And I think maybe the problem that we had early on was not being clear about that here's what we know now, here's what we're doing to learn more, and when we learn more, it may change what we tell you in the future. I think that's going to continue to happen not only in a pandemic, and so I think this is always an evolving process, and to recognize that science is that process. It doesn't represent truth per se, but it's really the pursuit of truth, which is why it's important for both the practitioners and patients to understand that things do change over time, and that may change the way we make recommendations.
And now we've reached the point where we'll take questions from the media. Please note that this portion of the event is reserved for questions from credentialed media only about flu, COVID-19, RSV, and pneumococcal disease. And as you ask your questions using the Q&A function, please identify yourself in the media outlet. We'll get to as many questions as we can, and we'll follow up after the briefing as needed. I do have some questions to get us started, and let's start with one. And I can make this open for any of you that would like to answer. How do you see the current landscape of uncertainty around immunization impacting vaccine uptake and public health outcomes for the next year? Sean, do you want to start us?
Yeah, that's a biggie. So I think there is a lot of uncertainty. As I said at the top, there's a lot of confusion out there, not just among parents and patients, but among clinicians themselves. Frankly, I'm confused a lot of the time with what I'm seeing. And so that can't be good. I think all of us on this panel, many others, are doing everything we can to kind of navigate through that confusion, to help the families we take care of understand, the science behind vaccinations, the importance of vaccination. But it's a challenging time. I'm particularly concerned about threats to vaccine access. I think, in some ways, some of the things we're hearing coming out of ACIP, they've almost jumped the shark, if you will, in terms of, how it's gotten pretty crazy, I will say. I think we can work with our families in terms of how we help navigate the hesitancy questions, the refusal questions. I'm really concerned about access, though, because some of a lot of times what happens in health systems or in payers, et cetera, is if something isn't certain, it just doesn't happen. And because there's so much uncertainty here, I hear all kinds of stories about people trying to go in and get a vaccine at a pharmacy, and they are clearly eligible for that vaccine, and they're told they can't get it. And I think we may unfortunately see more and more of that. I'm also very concerned about threats to the Vaccines for Children program, which provides vaccines for roughly half of America's kids. Already, my understanding is that COVID vaccines have still not been shipped for those children, again, half of America's children, from CDC, because the ACIP vote has not been signed off on by the acting CDC director. So tons of concerns about access from my perspective.
Can I just weigh in quickly on Sean's issue? So just on the last part, that's my understanding of how it works. The ACIP is advisory. They provide advice, but it's up to the government to make decisions, and they haven't been made yet. We now have a shutdown, and it's unclear how that might affect all kinds of things in government, including finalizing those decisions so that that can sort of pull the trigger to start shipping vaccines.
I think the other real concern with creating confusion is that it creates confusion for more than just vaccines, right? So pregnancy, people being worried about Tylenol and then worried about, SSRIs for depression, and then vaccines on top of it, it puts a tremendous amount of pressure on patients, on pregnant women who are just trying to do the best they can for their babies. So I think in some ways, it undermines, that ability for shared decision making on almost every aspect of medicine. And so, I obviously we're very concerned about, vaccines, but there's other aspects of medicine that will be equally sort of attacked, I think. So it's something.
And in a healthcare system where you only have a few minutes to cover all these topics, at the same time, you want to encourage people's questions because they're coming with a concern, and there's clearly an ability to address them if you know what they are, but then the clock is ticking.
Right. Exactly.
Well, let's come at a slightly different direction. Again, open question for all of you. What sources of immunization information should our patients and should our healthcare professionals trust? And where should they go for that information? Laura, do you want to start that one?
I think, the practical part in me says that's what we do really well at the American College of Obstetricians and Gynecologists is we try and hold all the information that we can and put it down into digestible bites that, that OBGYNs and midwives can sort of look at very quickly and make assessments. And I think that we have built over many, many years trust amongst our members that we are looking at the science, we are trying to make a judgment, and we are trying to help guide OBs when they're speaking with their patients. So I think we take what we learn from, the Vaccine Integrity Project and our own look at the data as well. Actually, it's not that we just take that, but we are constantly looking at the data and, putting that together to make the best guideline possible. We have a task force specifically on immunization at ACOG that has been around for more than 20 years. made up of people who are incredibly passionate about it. And so they're constantly looking at the science and challenging. We have definitely been out there and said that there wasn't enough safety data in pregnancy on certain vaccines for us to make a recommendation. And then we demanded those studies be done. And it allows us to then be able to make, good recommendations, safe recommendations.
And I can follow up on that. So the American Academy of Pediatrics has been making vaccine recommendations since long before ACIP, since the 1930s. Every year we put out our own schedule, and we will continue to do so. When I talk with parents about, where do you get good sources of information? I recommend staying as far away as possible from social media, because you never know what's there. I also recommend vetting any source you use. Some people, that is their main source of information, but make sure you vet that source. Where is it coming from? Do they have an agenda? Is there some hidden agenda? Because often the anti-vaccination things you'll find online, there is a hidden agenda, usually financial. But otherwise, places that are good to go. So I would say the major professional societies. So AAP, the American Academy of Family Physicians, ACOG, of course, the American College of Physicians, Infectious Diseases Society of America, Pediatric Infectious Diseases Society. All of those have troves of really sound data and information. I'll mention a couple of other organizations. The National Foundation for Infectious Disease. We've been putting out trustworthy information for more than 50 years. That's a good source as well. Immunize.org as well. And I shout out to the Vaccine Education Center at the Children's Hospital of Philadelphia. There's a lot of great detailed information there as well.
So, Sean, it's respiratory season. How can pediatricians help families navigate the multiple vaccinations recommended for children, particularly as we're in this time of year where we've got particular viruses on our mind?
Sorry. So say that another way, Bob.
How can we help families navigate multiple vaccinations recommended for kids, particularly as we're in respiratory season where we're talking about additional vaccines as well?
Sure. So when vaccines are studied before they're put into common use, they're studied in combination to make sure that they're safe to give, to make sure that they don't cause one vaccine not to work as well as it should. And so we were confident that both when we give vaccines at the same time and that they're both effective and they're safe. So we know that they work and we know that it's safe to do so. The idea that kids can get too many vaccines at once is really basically a myth. The main problem is the pokes. Like we don't like, nobody likes shots, right? But it is perfectly safe to give multiple shots in a single visit. And I generally recommend that because it gets it out of the way. And, having given vaccines to a lot of babies over the years, the baby cries if they get one, they cry if they get three. And they get over it pretty quickly, and that's the end of it. So I tend to recommend getting them all when you're in the office and they're available, perfectly safe to do so. And that's what the vast majority of pediatricians recommend as well.
Let me frame that just the same information is a little bit differently. While Sean's right, the focus is on the pokes and the pain that comes with that and the crying that comes with it. But I think you have to take a step back and think, what are we doing? The diseases that we're preventing. When I was a kid, there were not many. And when I remember in medical school, we used to call these the usual infections of childhood. Now they're called vaccine preventable diseases. And thanks to the development of these vaccines that have come about. So I think while the focus is on the pokes and the number of shots, remembering what you're protecting against and what impact that's had on childhood and society at large.
The other thing to remember, which I try and remind patients, is you're protecting yourself, you're protecting your baby, you're protecting your family, right? So, and we know this from years of using these vaccines. And then the other thing always for me to remember to remind women or pregnant women and their families is that the schedule is there for a reason. And it's probably not a good idea to come up with your own schedule. It's been tested as Dr. O'Leary said, and there's a reason behind it. So coming up with your own idea is probably not ideal.
Right. So we have a question from Lauren Neergaard at AP. Can you address flu vaccine effectiveness and how it may be better at preventing severe disease than infection? Also, how worrisome are the 109 cases of pediatric flu-associated encephalopathy last year? Dr. Larry, you want to start that one?
Sure. Yeah. So, there's a lot of sort of myths out there about flu vaccine. One of them being that, well, I got it and I still got the flu. The flu vaccine is, and this is true really of almost all respiratory vaccines, they may not be perfect at preventing you from getting infected, but they're often very, very good at preventing severe outcomes. And that's really true of influenza vaccine. So, for example, for kids, if in a given year, for example, the data come out and say that the flu vaccine was 40% effective at preventing influenza. If you look a little further in the data, it's like 70 or 80% effective at preventing hospitalization. Some years it's 90% effective at preventing ICU admission. And that's really what we care about. I mean, obviously we don't want kids to get sick, period, but the most important thing is preventing those severe outcomes. The question about the flu-associated encephalopathy last year is an important one. That's one of the complications we're talking about. That's a particularly severe and highly fatal complication. But there are lots of other complications that happen from influenza really across the lifespan, but including in children. And you saw, for example, what happened with the video at the beginning of this press conference. That's the kind of thing, unfortunately, that we do see every year. And the influenza vaccine is highly effective at preventing those severe outcomes.
I mean, Sean Carr, let me just add though that, I mean, part of when you look at that sort of 50% efficacy that Laura mentioned, in contrast to the other childhood vaccines, which are miraculous how effective they are, then you could argue that they may be more effective than other parts of medicine. But it also identify the we need to do better. These are good, but they're not perfect. And we need to have a next generation of vaccines that are better at preventing infection, stopping transmission, have long-term immunity. Those are the things that really are in the future. The question now is whether or not those are going to happen given the current supportive research. But we have a very good vaccine. We need to have a great vaccine, and we need to get there with investing in research.
I'll just add in terms of pregnancy, which I think sometimes people forget, is that not only are we counting on, say, the flu vaccine to reduce the severity of influenza infection during pregnancy, but that can play out by protecting people from having premature babies, right? You get a really bad flu infection and you start to contract and deliver at 30 weeks. We're all sad. Really sad, because now you've got a lifetime of having a 30-week baby in the NICU forever and all sorts of downstream effects. So it is incredibly protective, even for those people that said, but I got the flu anyway. But you didn't land in the hospital and you didn't have a premature baby.
So we spoke earlier about some of the potential access challenges for COVID-19 vaccines, and you mentioned that not available through VFC yet. And I've run into anecdotes from family members and friends that have had trouble accessing vaccine in this last few weeks. Are there any concerns about access to vaccines for flu, RSV, or pneumococcal disease that any of you have heard about to this point?
So I can tackle that. Flu, no. I understand historically we have had problems with late delivery of flu vaccine or shortages. I am not aware of any of those now. And flu vaccination season is up and running. RSV, I think we have in the first year that nirsevimab was rolled out, there were it came a little bit late just based on the timing of when it got approved and recommended. But I'm not aware that we're having any supply issues or access issues. Clesrovimab being a new product, I haven't really heard how much market share that one's gotten yet, but I'm not aware of shortages for prevention of RSV. COVID, see previous discussion. It's a challenge right now. I mean, even in prior years, I know that some families had trouble finding a place to get their child vaccinated against COVID. And I think that's unfortunately worse this year based on what we're seeing from ACIP.
I think also there's always been the concern about what do physicians carry in their office. And so we've done a lot of work and a lot of campaigning to get, flu vaccine in the office, RSV vaccine in the office, so that you're not sending people away to go find their own, because we know that will drop off. Even if they wanted it, it's too hard. I think we haven't done as good a job with COVID vaccine. And so I think that that's something that we're going to have to look at, because it also is a little bit of a mixed message. You know, I tell you, I really think you should have this vaccine, Mrs. Jones, but go find it. You know, that is probably, it should really be, I really think you should have this vaccine, and my, you know, assistant will give it to you on your way out the door.
So we've mentioned this in bits and pieces, Dr. Riley, but let's come back to this again and really put a point on it. Can you talk about the impact of maternal immunization on infant health outcomes?
Yeah, I think the premise is this, is that we know if we give women the appropriate vaccines, i.e. here, flu, COVID booster, and RSV, they will develop antibodies to those infections. Generally, it takes about 2 weeks to develop an antibody response that then crosses through the placenta, through the umbilical cord, and allows for protection of the baby. And, you know, certainly for flu as well as for COVID, we're talking about protecting the baby for the first, 6 months of life when it's at its, when it's most vulnerable and hasn't been vaccinated. So it's incredibly important for babies. The good news with RSV is that their vaccine is available. Again, we need the 2 weeks to develop an antibody response that transfers through the placenta. But if for some reason someone is outside of that window or has had it in previous pregnancies, there is then nursivimab and the other monoclonal antibody that I cannot pronounce yet, that they can be given in the hospital before they leave, actually right after birth. So
this may be a bit of a softball question, particularly coming from the moderator who had 3 vaccines earlier this week at the same time. So when is the best time to be vaccinated against flu and COVID-19? Can the vaccines be given at the same time and in the same arm?
The best time is today. If you haven't already had it, get it. I got mine yesterday.
As I said, important to raise the softball issues as much as the more challenging those.
Exactly.
So, we've spoken a lot and focused really our efforts around vaccination, but we have to remember there are other components that we can put into our prevention strategies. What other prevention strategies would you emphasize for patients, families, and our healthcare professionals during respiratory season?
Sure. I mean, we can just go back to, what we learned in kindergarten. Say your ABCs while you're washing your hands. So, washing your hands is a really effective way at preventing spread of disease. So that's one thing. Staying home when sick, particularly when you have a fever, there's guidance out there for, when kids are less contagious, and it's okay to go back to school, but if they have a fever, they should stay home. So those are really simple things. Some people still prefer masks. Masks do reduce transmission, both for the person and for spreading to others. And so there's, some people don't like masks, but they do work. And those are kind of the biggies that come to mind for me. But washing your hands is really a straightforward, simple one.
And all healthcare workers. So sorry,
Yeah.
Bruce, I had to just throw in there. Healthcare workers need to get vaccinated. We can be the easiest and fastest, group to spread infection. And so, we need to be 1, examples for our patients, 2, protect ourselves, and 3, protect our patients.
So these are respiratory viruses. So it's the air that you breathe. So pay attention to the air that you're breathing. If you're in a place there are a lot of people breathing that same air, you might want to think about how you manage that by staying away or being near where there's a vent or so. I had hoped, and I'm not sure this will happen, that our experience with COVID would be sort of the next revolution in public health, and it would be that paying attention to air and HVAC systems would be the equivalent of what we learned from water and sanitation a century ago. Maybe that's happening, but again, these are respiratory viruses, so breathing somebody else's air is what gets you in trouble if they are shedding.
Well, and I just came back from clinic to join this news conference this morning, and I'm wearing a mask in clinic because we have high levels of certain respiratory viruses in my part of the country. And so, even though you may have think about good air exchange in healthcare settings, you're in a small room with people. And so we've got to think about using all of those tools. So, as we're coming toward the close of our time, I'd like to give each of you a moment to kind of give your last thoughts to the press about respiratory season and respiratory season protection for this population. And I want to start with you, Bruce.
No, I said there are a lot of perspectives. I think you're going to hear them from the clinicians on the screen here. But again, I get back to the evidence. You talked about access and equitable access to the vaccines, but you also make sure that people have access to the right information. And we've highlighted before, that information is available. It's in the guidance that's provided by ACOG and AAP and the other medical societies. And I think when people have questions, they should start there and look there. And when they have additional questions, they should ask their healthcare provider about them, because they're prepared to answer those questions to help guide people through this season. And again, as you heard before, is a strong recommendation by your clinician is probably the most important thing, because they're trying to do what is in your best interest as a patient.
Sean?
I'll keep it simple. The best way to protect your child and your family this respiratory season is by making sure your vaccines are all up to date. And a very simple, safe intervention that will go a long way to keeping kids healthy.
And Laura?
And I will just reiterate that, vaccinating mom to protect her from these respiratory viruses is incredibly important for her safety. And then it's a 2-for-1. You can also vaccinate mom and protect the baby, which is really important.
Right. Well, thank you all for your participation. I want to thank everyone who's joined us today. We encourage you all to show your support for vaccination by joining the NFID Leading by Example initiative. Share your vaccination photos on social media using hashtags #GetVaccinated, #FightFlu, Prevent Pneumo, Prevent RSV, and Stop the Spread. And be sure to tag NFID. This news briefing series is sponsored by NFID in collaboration with professional societies and patient advocacy partners, and unrestricted educational grants from AstraZeneca, Sanofi, and Securus USA Incorporated. Note that NFID policies prohibit funders from controlling program content. Please note that our next news briefing on October 29th will be focused on healthcare professionals, as you all mentioned here today. A video of today's briefing, partner resources, and information on the series will be available on the NFID website at nfid.org/2025 flu news. Thank you to the panelists, to our partners, and to the participating media for all you do to help raise awareness and educate the public about the importance of disease prevention. Your partnership is essential to protecting public health. Thank you again. Get vaccinated if you haven't done it already. And stay healthy.